My name is Chloe Benoit, and I'm going to be presenting on stimulants and ADHD. So, what is ADHD? That is the abbreviation for Attention Deficit Hyperactivity Disorder. And essentially, this disorder is a behavioral condition that affects an individual's ability to regulate attention and executive functioning. According to the American Psychological Association, they no longer diagnose individuals with ADD, but rather they just diagnose individuals with ADHD. And with that diagnosis, they may have one of the following three presentation types of ADHD. So the first is ADHD predominantly inattentive type, which was in the past known as ADD or diagnosed as ADD. The second type is ADHD predominantly hyperactive slash impulsive type. And the third is ADHD combined type, which, similar to the name, is a combination of both the inattentiveness and hyperactivity seen in the other two types of ADHD. And some common symptoms you may see in individuals with ADHD include trouble focusing, excessive activity or restlessness, poor time management skills, disorganization, mood swings, which may include things like a temper or low frustration tolerance. And so, how prevalent is ADHD in the United States? Well, according to the CDC National Survey of Parents done in 2022, it's estimated that roughly 11.4% of children between the ages of 3 and 17 have been diagnosed with ADHD. And while this 11% may not at first glance appear to be a large number, if you compare this number to the population of the United States, that's still roughly equivalent to 7 million children being diagnosed. And it's also important to keep in mind that this 7 million does not include any adults that were diagnosed with ADHD in that year. Because while symptoms of ADHD appear in early childhood, they often persist into adulthood. And so these children carry over these diagnoses with them as they get older. Treatment-wise for ADHD, providers oftentimes use two classes of stimulant medications to manage their symptoms. So the first class is methylphenidate, and the second class is amphetamine. And so while there are a lot of generic and brand name medications within these classes of stimulants that are used, for methylphenidate, the most commonly used brand name is Ritalin, and the most commonly used brand name of amphetamine is Adderall. And so which of these two classes of stimulants are more effective? It's not very clear cut. There has been research done to try and determine this. However, it wasn't definitively shown that one necessarily works better than the other for any particular reason. It's just been shown that some individuals just tend to respond better to methylphenidate, while others tend to respond better to amphetamines. And so providers typically, when prescribing these medications, they'll start off with one class, and if that's showing to be ineffective, they may first attempt to adjust the dosage of that medication to see if that will help. And if it's still ineffective, then they may switch over to the other class of stimulant to see if that will help to better manage these symptoms. And so why are these stimulant medications useful? So there's no exact causes of ADHD that are known, and so but there still are studies that do suggest that it's often associated with cortex deficits, predominantly in the catecholamine-rich regions of the brain. And so in these regions, you have neurotransmitters like dopamine and norepinephrine, which are very important for high-level executive functions. So things like working memory, attention, reasoning, planning, problem solving, motivation, and impulsivity. Um, and these functions are often seen as being impaired in individuals with ADHD. And so when you use medications like methylphenidate and amphetamines, these medications increase brain catecholamine activity. And so because these stimulants are showing to be effective in managing these symptoms, it's theorized that they are possibly reversing these catecholamine associated deficits and therefore taking away some of this impairment of these high-level executive functions. And it's also important to keep in mind that stimulant medications are not a cure for ADHD, but rather they are just helping to manage these symptoms and decrease that impairment. And it is important to note that there are some studies that have shown that stimulant medications are effective for about 80% of children that use the medications. And there is also behavioral therapy that is oftentimes paired with these stimulant medications as well. Some negative side effects of these medications may include decreased appetite, and with that, weight loss, possibly difficulty sleeping, anxiety, minor growth delay, upset stomach, so nausea and vomiting. There may also be an increase or a decrease in blood pressure, and because it's a stimulant, there sometimes associated a increased heart rate. And then with the stop of these medications, there is sometimes a period of fatigue, increased activity, or bad mood. And here are my references, and thank you.